Thank you very much, Chairperson, and hello, everyone. And thank you very much for inviting me to this conference. It's my great privilege to talk about my topics. So this is the pivotal meta-analysis from Korea. Dr. Jang published this data. In this data, as you may know, transradial intervention compared to transfemoral intervention clearly reduce not only the MACE, but all-cause mortality. And this data encouraged Japanese radialists, including me. And also, this is the matrix trial published in 2015. In this data, transradial intervention for primary PCI clearly reduced the prevalence of MACE, and not only the MACE, but not only the bleeding complication, but also decrease the mortality. So according to these trials, ECG guideline recommended transradial intervention for primary PCI, as you may know. So in our institute, we changed the strategy, moved to the routine transradial intervention for primary PCI in 2015. This is a trend of the access site during the ACS PCI in our institute. I started working for my institute here. Then matrix trial and also the ECG guideline was published here in this point. And we changed the strategy from to the transradial intervention. Only 1 year later, the prevalence of transradial intervention, that's a red and orange bar, is up to 90%. Of course, conversion to transradial intervention for primary PCI reduced the bleeding complication clearly, but interestingly, it reduced also the procedure time significantly. But some problem remained is complex primary PCI can be done from the TRI. This is the case of proximal anterior MI, occlusion of the proximal LAD. After the wiring and the thrombus suction, you can see the diagonal branch here. Territory is not so small, relatively large. So how to treat the true bifurcation in this situation, primary PCI? Only gelled wire or final kissing balloon inflation or something? But there may be the high risk of the side branch occlusion after main branch stenting. So we chose modified gel balloon technique for this patient. In our style, inflation simultaneously both main vessel stent and side branch balloon simultaneously twice. Then finally inflate the stent balloon after the removal of the side branch balloon. This is the final branch, angiography. You can see the good flow in both left LAD and diagonal branch. The result is fine. Modified gel balloon technique was established by Shigeru Saito, regent of TRI. He published in 2018, but he demonstrated this method in the Kamakura Lab in 2015. But original method, final kissing balloon was mandatory like this, but we a bit modified this method. In our method, in case of true bifurcation, inflate main vessel stent and side branch balloon simultaneously twice, and then remove the side branch balloon, and then stent balloon inflation alone. Now, this is the final result. This is the OCT image after our method. You can see the well-opposed stent strut, and also there is a space of the side branch. So this space is made by the side branch balloon. In this method, we didn't need any additional kissing balloon inflation. So this simple method is suitable for the primary PCI, I think. This is the result of our method, modified gel balloon technique. Even in the high risk of side branch occlusion, modified gel balloon technique clearly reduces the prevalence of transient side branch occlusion compared to traditional gelled wire technique. So another problem is cardiogenic shock during the STEMI. This is a patient with anterior STEMI with cardiogenic shock. Systemic blood pressure is less than 80. This RRC is also occluded. So we inserted impeller for the PCI support before the intervention. After the introduction of impeller, we performed the primary PCI, opened the LAD. It was also the true bifurcation lesion, so we used modified gel balloon technique like this. After the procedure, we can get the blood flow, but coronary blood flow did not look so nice because of the sustained hypertension, but we continued the unloading with impeller for a couple of days. 1 month later, we checked the blood flow. You can see the good blood flow in both LAD and a diagonal branch. And his cardiac function, LV function, was a bit recovered from the shock status. So this is my take message. Transradial primary PCI is currently global standard, and it reduces bleeding complication and improves clinical outcome. Modified gel balloon technique is suitable for keep it open strategy during PCI, make it easy. And also, TRA has an advantage as a residual access site when mechanical support is required in case of STEMI with cardiogenic shock. Thank you very much for your kind attention.